Hey, good morning. It's Monday, September 30th, the last day of September. How did that happen? Anyway, last week, America's Got Talent, Richard Goodall, he was, I believe, a school janitor from Indiana. He won the competition, and I believe he gets $1 million and a Vegas act. Speaking of Indiana, the Indiana Fever and the WNBA were beat by the Connecticut Sun. The Indiana Fever is Caitlin Clark's team. So they're out of the competition, and with it, now who cares about the WNBA again? Anyway, and also, recently, the iPhone 16 is out. Have you gotten yours? Have you upgraded to the iPhone 16? And if you're an Android user, is that what you want? I don't know. I'm still working off of an iPhone 12, and it works perfectly fine for me. Anyway, let's get to today's topic. Hey, tomorrow is October 1st, and what's big about that date? That's the date that we can start marketing to you legally, Medicare Advantage plans and prescription drug cards. Yay, okay, so there's going to be some big changes, and I know about some of these things because you already have, at least a lot of you already have your materials for the renewal for next year, and you've been calling me up saying, Mark, my premiums are going through the roof. I know that. Don't need materials to tell you that's going to happen. And I now have a $590 deductible. A lot of you are getting that. Well, let's talk about that deductible here. The insurance companies have to offer a plan at least as good as Medicare. Medicare has always had the deductible. This year, for 2025, it's going to be $590. So a lot of the prescription drug plans are doing away with that. Why would they do away with that? Well, if you can remember last year, I've talked about this in the past, there's the Inflation Reduction Act. That said that diabetic medication can't be more than $35 a month. But now, this year, for 25, they're doing away with the catastrophic coverage, which means that the most you can spend on prescription drugs is, believe it or not, $2,000 in a calendar year. So, you know, when they promise you something for nothing, that's not true. Something always costs something. And in this case here, your diabetic medication is just $35, to repeat, and you've lost your catastrophic coverage, so you're capped at $2,000. This is expenses that the insurance companies have to absorb. I'm sorry, no matter what we think, an insurance company is not a non-profit organization. That's the government at best, and they always finance into the future. So these things are costing more money, which means that your premiums are going up, and it means that now you're subject to the deductible. It's always been there, but for a lot of insurance companies, they were saying that, and they may still, I haven't seen everything yet, they may still waive the deductible on generic medications, but a lot of you are complaining to me that your carriers are not. So in going to the meetings now, I'm not saying this, I'm the messenger. In some of the meetings I've been to, they've told us about these deductibles hitting and the premiums going up. But if you want to get around it, go to a Medicare Advantage plan, because the prescription cards are built into most Medicare Advantage plans, especially if they say Medicare Advantage prescription drug plan. And that's mostly what I sell. Okay, Mark, I don't want a Medicare Advantage plan because I don't want to be limited to, you know, an HMO. Well, if you forget about Crazy Joe and Crazy JJ and Mike and Joan and all those people that advertise these Medicare Advantage plans in the middle of the day when you're watching, you know, MeTV and Gunsmoke and things like that, the ones where you're paying a premium, and really AARP and Aetna have some really good plans for right around $30 a month that have very large PPO. Did I say that right? Yes, I did. PPO networks. They have PPO networks. They have large networks. They include most, if not all, hospitals in the Chicago metropolitan area, which is where we are. So there are some really good plans that are out there, and they still offer that $0 doctor copay for your primary care doctor. So you know what? Hey, the number's on the bottom of the screen here. Give me a call, and we can find something that's in your best interest, even if it means staying put. At least now you know what your options are. You know, like I just said, give me a call. So here's one thing we at the MLD agency are still doing. A lot of people are not doing prescription drug cards anymore. We still do prescription drug cards when you have a Medicare supplement with us. And we're still doing, of course, the Medicare Advantage plans because that's the way of the future. Hey, what's going on at the MLD agency? Well, last week we started working with a new group for group health insurance. We're renewing a group, and we helped somebody transition to Medicare. That's what's going on. Oh, we also are working to find a new CRM. The old one, they've had some problems, not their fault. They think it's government related, but they're not working for us, which means they're not working for you. So we're looking at replacing them, and hopefully by the time you get this, that's already taken care of. Anyway, until next week, you take care.